many of us in the family. I cannot, if you have one person in your family that does not suffer from hypertension, that is a very good sign. So, our topic this morning is hypertension, and we'll be celebrating World Hypertension Day on May 17th. That is this Friday, Erlan, this Friday. And the topic is the theme for this year is measure your blood pressure accurately, control it, and live longer. We know many people, the services are free of charge to come in and check your blood pressure. Many people are very skeptical. Many people don't want to come in. They see the signs and symptoms, but yet still they hold back, especially our men, because maybe of so many things that is being said out there in the community, they're quite scared to come in. But if you know you have a family history, especially our men, especially our young men too, do come in and check your blood pressure. Stop by any wellness center or Soufriere Hospital and come in and check your pressure. I'm sure our CHAs and our nurses will be very happy to assist you. Well, without further ado, I will pass on the mic to Dr. Rose. Dr. Rose, can you kindly introduce yourself?
Hi, good morning, everyone. My name is Dr. Yola Rose, and recently I've stationed in at the Soufriere Hospital at the emergency department. Before that, I was at OKU emergency department. I'm actually happy to be down here with you guys. So this morning, we'll be talking about hypertension, and this is a very important topic. It's like what was said earlier, if you don't have one person in your family without hypertension, that's actually a huge deal because in St. Lucia, we are really plagued with hypertension in our households. So that's one topic that we need to familiarize ourselves with so we will know what to look for. When do we go look for help? When do we go check up and things like that? So first off, we need to actually understand what hypertension is. So, persons who hypertension or high blood pressure, as we all will know it as, it would be when your blood pressure is actually in your blood vessels when they're too high. Now, what do I mean by too high? First, we need to know what the normal blood pressure is, and that would be less than 120 systolic, and that's the number above, and less than 80, which is the diastolic number, which is the number below. So 120 over 80, that would be your normal. Now, it starts to be elevated or go higher when it's between 120 to 129 systolic and less than 80, which is below. Now, with hypertension, there are three stages. So, stage one hypertension would be your systolic numbers of 130 to 139 or diastolic 80 to 89. Hypertension stage two would be 140 or higher over 90 or higher. And we speak about hypertensive crises when the systolic is higher than 180 over higher than 120. Now, when we talk about hypertension and okay, what who are the persons who are at more risk of getting hypertension, or what factors that would actually lead to hypertension, we have those categories that are divided into two actually: modifiable risk. And what I mean by modifiable risk are things that you could actually do to prevent it, things you could actually do to reverse it, things that you would actually do that could actually change your dynamics of hypertension. And non modifiable risk factors, those are things that you cannot change. So, when I speak about modifiable risk factors, that would include unhealthy diets. So, having excessive salt consumptions, a high a diet high in saturated fats and trans fats, and a low intake of fruits and vegetables. Physical inactivity, so persons who don't do a lot of exercising, a lot of walking, that's a modifiable risk factor. Consumption of tobacco and alcohol is another modifiable risk factor, and being overweight or obese. Non modifiable risk factors would include having a family history of hypertension. So, a strong family history of hypertension would be someone in your immediate family. So, your mother, your father would be somebody in your immediate family that would have you at a risk of having hypertension. Persons who are over the age of 65 would also be a non modifiable risk factor. And if you already have coexisting or kidney disease, that would actually put you at a risk of getting hypertension.
Go
Now,
ahead, doctor.
now we're gonna speak a little bit more on alcohol consumption and hypertension. What is a correlation between those two? Because I mean, I do know we're in St. Lucia, we do enjoy alcohol consumption, but everything in moderation, and we need to understand our habits or unhealthy habits can actually lead to detrimental health issues. So, how does alcohol actually affect your blood pressure? So, drinking too much alcohol can actually raise your blood pressure to unhealthy levels, the levels we were talking about earlier. Having more than 3 drinks in one sitting temporarily raises your blood pressure, but repeated binge drinking can lead to a long term increase in your blood pressure. Now, to understand how much alcohol is too much alcohol, we need to know the definitions of what excessive drinking is like. So, binge drinking is defined as 4 or more drinks within 2 hours for women and 5 or more drinks within 2 hours for men. So, that's what we will call binge drinking. Moderate drinking is up to 1 drink a day for women and two for men, and heavy alcohol use is defined as more than 3 drinks a day for women and 4 for men. So basically, if you're doing binge drinking, moderate drinking, or heavy alcohol use, that would in turn affect you in the long term, which would increase your blood pressures. Acutely having too much alcohol will raise your blood pressure, like acutely at the very moment, but temporarily. But having a habit of doing too much drinking will definitely, in the long term, increase your blood pressures that would actually lead you to becoming hypertensive. Another factor that we need to also understand and really take into consideration is marijuana smoking and hypertension. Now, according to the CDC, marijuana can make the heart beat faster, and for that reason, can make the blood pressure higher immediately after use. Like just like alcohol drinking, the immediate actions would be okay, yes, the blood pressure would go up immediately, but long term use and heavy use of those substances could lead to increased risk of stroke, heart disease, and other vascular diseases. And in turn, of course, have your blood pressures at an alarming high rate. Most of the scientific studies linking marijuana to heart attacks and strokes are based on reports from people who actually smoked marijuana. So these are actually proven facts that long-term use of marijuana smoke will actually cause your blood pressure to, of course, increase. And moreover, increase your risk of stroke, heart disease, and other vascular diseases like kidney disease as well. Now, what are the signs and symptoms linked to hypertension? We need to understand when people say, hypertension is a silent killer, we really do mean it, because a lot of persons would be walking around with their pressures very, very high and they will not feel anything at all. So, most people with hypertension will not feel any symptoms at all. Very high blood pressures can cause headaches, blurry vision, chest pain, and other symptoms. So when your blood pressure is usually 180 over 120 or higher, you could experience symptoms like severe headaches, chest pain, dizziness, difficulty breathing, nausea, vomiting, blurred vision or other vision changes, anxiety, confusion, buzzing in the ears, nosebleeds sometimes, and an abnormal heart rhythm. So, checking your blood pressure is the best way to know if you have high blood pressure because, like I said before, some persons really do not have any of those symptoms until it's actually late stages where it's too late, where they find themselves in the hospital with a stroke or a heart attack. So, checking your blood pressure, especially with those who have those non modifiable risk factors, you need to be checking your blood pressures regularly to make sure that you don't have early hypertension or first stage hypertension or pre-hypertensive numbers. Because if hypertension isn't treated, it can actually cause other health conditions like kidney disease, like I mentioned before, heart disease, and stroke. Now, how do we go about treating hypertension? First of all, like we spoke about earlier, the modifiable risk factors. That's actually one of the best ways and the first steps in treating hypertension. So, eating healthy, low salt diet, if you're overweight or obese, losing weight could help resolve or put your levels at more of a safe point. Being physically active, and if you do smoke, quit smoking. And if you're a heavy drinker, you need to cut back on the amount of alcoholic drinks that you have. Now, if you have high blood pressure, you well, doctors will recommend one or more medications based on your blood pressure levels. We'll recommend either one, two, or sometimes three, just to bring you back at a safe level. So the recommended blood pressure goal would depend on what your other health conditions that you may have. Like I mentioned before, some persons who do have hypertension is not just being hypertensive, they also have some sort of heart disease like angina, or they would have, kidney disease as well. And based on those factors, that would determine what sort of treatment that they would actually be placed on. So, for most people, the goal is to actually have a blood pressure less than 140 over 90. And of course, those are the persons who are hypertensive, and that's all they do have is just hypertension. So, having a pressure less than 140 over 90 would be the goal. But if you do have things like cardiovascular disease, or you've had a stroke before, you have diabetes, you have chronic kidney disease, or you are at high risk of cardiovascular disease, then the blood pressure goal will be actually lower than that. It would actually be 130 over 80. And again, prevention is always better than cure. So I will stress again on lifestyle changes because that would actually help prevent, becoming hypertensive. It's always better to prevent a disease than treating a disease. So lifestyle changes can help lower high blood pressure and can help anyone with hypertension. Okay, so, but what you should also know, many persons who make those changes will still need to take medication, but that could actually be from, okay, am I going to be on five different types of medication to keep my blood pressure down, or just one or two? And just to prevent you being on so many different types of medications, lifestyle changes would help a lot. And just being on one medication or two is, of course, a lot better than being on five or six. And we have persons who are on sometimes five, six, seven different types of medications just to keep their blood pressures at a safe level. So, what are the things that you need to do? You will need to eat more vegetables and fruits, be more physically active, which can include just simply walking, running, swimming, any activity that would build strength, like lifting weights. Get at least 150 minutes per week of moderate to intense aerobic activity, or 75 minutes per week of vigorous aerobic activity. Do strength building exercises 2 or more days each week. Again, if you're overweight or obese, try to start, a weight loss regimen to work on that, and take the medications prescribed by your healthcare professionals. And always keep your appointments with your healthcare professionals to make sure that whatever regimen that you're on is actually working for you. Things that you need to stay away from. So, things that we're not going to be doing is to eat salty foods. So, try to stay away from salty foods. Um, don't eat foods high in saturated or trans fats. Again, the smoking of marijuana, smoking of tobacco, smoking on a whole increases your risk of hypertension, heart disease, stroke. So, that is something that we need to stay away from. And of course, drinking less alcohol, no to less alcohol, of course, will definitely help in preventing and help treating your hypertension.
Thank you, doctor. Doctor, I have a question.
Go ahead.
Um, sometimes you go to the well, you go and check your pressure, like we would say, and you get the first high reading, maybe over the 120 and 80, and you come maybe 2 months, 3 months after you get a high reading. So how would somebody actually know that I am actually hypertensive? I'm suffering with high blood pressure, because some people come one day, they stay another 5 months, and they come back. So how would you actually diagnose that person as being hypertensive?
Okay, so what we do recommend, patients, is to check your blood pressure 3 consecutive days, same time. So if you come today at 10 o'clock in the morning and you check your blood pressure and it's a high reading, we would not say, okay, that person is hypertensive. They need to come the following day, same time, check your blood pressure again. If it's a high reading again, we say, okay, you need one more reading. At the third reading, if it's consecutively high, then we can say, okay, that person is hypertensive. And again, based on the numbers, we can say either it's at stage one, stage two, or stage three. Now, if you're having readings above the 180 over 120, we don't need two consecutive readings again after that, because at that point, you're at a hypertensive crisis. Okay, so checking your blood pressure today and waiting 5 months down the line, that is not the safe way to go about it. You need to do, and if you have a machine at home, what we do recommend is just writing those numbers every day for the next 3 days and just bringing it in, just to show us, okay, those are my readings for the past few 3 days. What's going on with me? And then we can take it from there. But it needs to be done 3 consecutive days, 3 readings, to make a safer, actually, um, decision on whether that person is hypertensive or not. And of course, we as medical professionals will go into whether it's a primary or secondary thing. How do we go about treating it based on the numbers? All of that would be taken into consideration.
Okay. Another thing that you always hear persons saying when they come to the wellness center, they have that thing about people making me vex. That's why my pressure is up. Doc, can you enlighten us a bit about that? Because, they're saying, I was vexed this morning, that's why my pressure up. What correlation is that because you vex and your pressure is up? I do not understand that concept. Even when you tell persons, even when they are already diagnosed with as being hypertensive, they still come with that thing. That is why my pressure is up.
Okay, well, there is a correlation between high blood pressure and, I wouldn't say high blood pressure, I would say a high pressure reading
Mm-hmm.
and getting upset, right? Because stress levels, a high stress level can raise your blood pressure, but not to extreme levels. The same way pain can raise your blood pressure to, well, can raise it, but not to extreme levels. But it should not stay that way for an hour, 2 hours. Your blood pressure is still at that level, because as soon as you calmed, your blood pressure should go back to normal if that was the cause. So persons need to,
That
but I'm no longer upset. So why is my pressure still high? I was in pain, but I'm no longer in pain. So why is my blood pressure still high? If that is the cause for the high reading. But then again, how high is the reading in the first place? So we need to explain that to people when they come in and said, "Oh, but doc, I was upset, and that is why, I think my blood pressure is high." But are you still upset though? And if you're still upset, there's a cutoff. It should not be 180 over 120. It should not be a 210 over 115. Like, that's way too high.
yeah. Another thing, some people do say, and I'm bringing this up because you hate all the time, and even when you explain to people, they don't seem to understand. I mean, you ask them, you tell them the correct thing, but yet still they have it in their mind because I mean, generations upon generations they come with that same thing like, I cannot check my pressure because I work too much already. Like whole day in the hot sun working, I cannot check my pressure. Doc, is there a reason for you not to check your pressure because you've been working in the hot sun whole day? Especially the men, they like to say that, especially when you have outreach programs. When they're passing by and you say, "Well, come and check your pressure." They say, "But I was working in the hot sun whole day. I cannot check my pressure." So, what
Yes, I
advice do
actually
you have
have
for
heard
these
that
people?
before.
Yeah. Yeah.
Before, well, it has. I don't, there's no real correlation with that. As long as you're seated or rested for at least 5 minutes, that shouldn't be a problem. Working in the sun whole day would not do anything for you. But I mean, yes, you could just have a seat. We'll wait 5 minutes, and then we'll check your blood pressure. Right? So those excuses, like you said, especially the men, oh my gosh, they would come up with a lot of excuses not to check their blood pressure. But we need to understand, again, prevention is better than cure. So let us catch it early, in the early stages, where we could educate you on maybe lifestyle changes where you don't have to be on medication, where you could just do some modifiable changes so you don't have to be on any sort of medication. So, again, you mentioned earlier, those are things that are actually free. Going to check your blood pressure is free. So that should actually be a good reason why a lot of persons, especially those who have those non-modifiable risk factors, to just go check what your blood pressure is like. It doesn't have to be an everyday thing. It can be a once a week, or once every 2 weeks. If you're not hypertensive, you can go ahead and do that.
Okay. So one of the issues that you have, especially out there in our community, is that when the men are diagnosed, they stop taking the medication because they have that notion, um, that the medication is causing erectile dysfunction. They cannot get it up anymore, and they're saying that's one of the side effects of the medication. And so they stop taking the medication, the pressure goes back up, then they come back, they take it for a few days, and then they stop again because that is, or one of the reason that they don't even come to check their pressure is that they believe, because of that medication is going to cause erectile dysfunction, and so therefore they tend to stay away
Okay,
from
so
actually taking the
basically,
medication.
what I do advise a lot of my patients is, okay, some medications may not work well with you. You may have some side effects that some other persons won't have. So, starting your medication and seeing how it goes with you, if there are any adverse effects, you come back and we speak about it, be like, okay, doc, this is what's going on with me when I take the medication. Then there's so many different classes of antihypertensives I can put you on. You don't have to stop the medication altogether. We just try something else. Once we try something else, we go again. Because some of those medications, yes, they do have those adverse effects. But stopping the medication altogether, it's actually a lot worse. So all you do, you come back and just communicate with us, tell us, okay, what's going on with you, how the medication is working with you. If those are the issues that you have, we're just going to change it to something else. And then you start that. But stopping the medication is a lot worse because those are people that will come in stroke or a heart attack, and now you go from not being able to do anything for yourself whatsoever. So again, communicate with your healthcare providers. That's what we're here for. We start you on medication. You can order it any odd way. All you do, you come back and you just communicate that with us, and we go according to that. We change it, put you on something else. But there's under no circumstance should you just stop the medication.
Doc, we kind of lost you a bit. Are you hearing us?
Doc?
We kind of lost you a bit, doctor. She just asked me, it's cutting off?
Yes, it is cutting off. You back with us, Doc?
Yes, I am.
All right, nice.
Ah, I guess the Wi-Fi is giving a little problem this morning. Um, we didn't hear the last part you said, doctor,
Where did I get off? What was the
about
last thing?
coming back to the health professional.
Right. So basically, if any adverse effects that you're having, whenever you start any new medication, what they need to understand is that your body first off needs to get accustomed to it. Because remember, you putting in something strange into the body. The body's not accustomed to it. So some persons, it will take some time for the body to adjust to the medication. So, first off, you need to give your body time to adjust to the medication. So, feeling weird, feeling off is not a reason to stop the medication. If the medication now is making you feel sick, then you come back to us immediately and you communicate what's going on with you. We could either tell you, okay, that's something that's okay, can happen, but just give your body some time to adjust to it, or we change the medication because there's so many different types of antihypertensives that we can just change the medication for you that you will react differently to it. So stopping the medication altogether without the advice from your healthcare profession is not the right thing to do. We're actually here to educate you. We're actually here to make sure that whatever treatment that you're placed on, the in the best way for you, because we do understand not everything works the same way with everyone. So basically, you come back to us, communicate with us how it's working for you, how you're feeling, and with that, we can continue your treatment. But under no circumstance you should ever stop the medication without the advice from your healthcare professional.
Another thing, doctor, the moment some people are diagnosed with as being hypertensive, many people, I mean, the first thing they start with is the bush medicine, the herbs, and so on. So, what
Yes, waiting
advice do
for
you
that
have to
question.
these people, especially in our culture? I mean, you have high blood pressure, they'll tell you, well, go and drink this, go and drink that, go and drink this. And even when the doctor gives them the medication, they already start with the bush medicine before they start taking the prescribed medication.
Okay, so yes, that one I always tell my patients, okay, you want to take your bush medication, that's fine with me. You want to take it, that's okay, but we have a deal because I am not going to try to force anyone to take prescribed medication because it needs to make sense for them. For them to take the medication, it needs to make sense. So I always tell them, if you want to take the bush medication for a week, take it for a week, but then write your blood pressures down for me every day. If the blood pressure is not going down at all, we're going on the prescribed medication because they need to see for themselves that it is not working. And I will always tell them, okay, we can all I can start you up on just one. You could take your bush medication, but at least take one of the prescribed meds that I'm giving to you. But you need to be following up with me every week because I don't want you coming in here with a stroke, or now you're going into kidney failure because your blood pressures are not controlled at all. And again, those are persons with stage one hypertension. I will not recommend anyone with stage two or hypertensive crisis telling me about just taking bush medication. That's not going to work. We're at a point right now where I'm seeing a lot of people coming in with strokes, heart failure, with kidney disease because their blood pressures are wildly uncontrolled. And then when you ask them, did you know that you're hypertensive? They will tell me, well, yes, I was told that, some time ago, but you see the medication, I was just going on my bush. I'm like, you see, no, 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 no. You were told that you're hypertensive and you were placed on treatment for a reason. It's like taking multivitamins on a morning. Most of those meds you take it once every morning, and that's it. You just take it in the morning, and that is all. So if you just put it into practice, that it's like you taking a multivitamin on a morning, just take it once and done. In the morning, I have to take my multivitamins, I have to take those meds, I take it in the morning, and I am done for the rest of the day. That would actually help you a lot more than you coming to the hospital when you cannot move your whole right side or you cannot speak, you have a heart attack, now you cannot do anything for yourself, your kidneys are now failing, so you now have to go and do dialysis 3 times a week. Guys, this is not something that you would want to do. Just take the medication on a morning and go about your day and you will be fine. Keep checking up with your healthcare professional to make sure that the treatment that you're on is actually working.
Thank you, doctor. I kind of like the fact that you give them the option of taking the bush medicine for the week, and ensure that they're monitoring. At least they know. I mean, what is actually working for them and what is actually not working for them. Even that too. Sometimes you tell people, well, they know they're hypertensive, they're using the bush medicine, but some of them seems to still be in denial, that they're actually hypertensive, because they come in and you say, no, yes, I know I have high blood pressure, but I don't think I have high blood pressure. The doctor just tell me that. And some people are still in denial. Yes, the doctor have diagnosed you, but at the same time you still feel you don't have it. I guess because some of them don't see the signs and symptoms until, that's when they actually reach at our wellness center, and then they give you that kind of response. Because they're so sick now. They'll tell you, yes, they have been diagnosed, but they don't believe they have it. But why did you come here in the first place? Because you now getting the signs and symptoms, and you cannot stay at home, and you need medical treatment. So I just want people to be mindful of these things. Denial when you have a medical condition can prevent you from doing a lot of things that the doctor have prescribed for you. So having said that, doc, I know our time is coming on. What do you have to say? Any messages out there for our people that are actually diagnosed with hypertensive, or our young people who has a family history of hypertension? And what message you have for these persons, especially our young persons?
Well, what I have been seeing coming into the hospitals, I would actually say a lot of young people now are suffering with hypertension, and it have a lot to do with their lifestyle basically. And what I need for us as a people to understand is it would take just small changes to actually help you with your health issues. You don't have to be hypertensive, especially if you don't have one of those non-modifiable risk factors. And if you do have those risk factors, you don't have to get hypertension, right? So being more mindful of our lifestyle, how much alcohol we drink, the smoking, the way that we eat, our sedimentary lifestyle, all of those things can pose a huge problem with our health. And that's not something that we should take lightly, especially with our healthcare system right now. So, any step that we can take to prevent, and I will always stress on prevention, any steps that we can take to prevent becoming hypertensive, we should take it. So, again, eating healthier, cutting down on the amount of alcohol that we consume, stop smoking on a whole, right? And those who do smoke, let's try to cut down until we get to a point where we no longer smoke. And again, the way that we eat, the just being I wouldn't say lazy, but not doing too much activity, those things need to change. Just going walking is a huge can make a huge difference. Cutting down on the salt intake is a huge difference in our lifestyle. So especially with the young people, we need to be more mindful of those things, because having a young person coming in at the age of 30, 35 with a stroke, that's something that we normally don't see, well, way back when, but now that's something that we see a lot now. Young persons coming in with strokes, young persons coming up with heart disease, young persons with kidney failure. So those are the things that we need to really be mindful of. So please take care of yourselves, people out there. My solutions: take care of yourselves, exercise, eat right, and just try to be as healthy as you possibly can.
Thank you, Doctor. Well said. I just want another thing that maybe we're seeing now is even our younger children between the ages of 15 and 20, and even at the primary school level, some children already displaying that kind of reading. So we want our parents also to be mindful of what they give their children to eat, the
Mhm.
processed foods and so on. Especially if they themselves have a history of hypertension in the family. It starts from a very early age. What we give our children, what practices we have at home, maybe like you said, exercising. Maybe the family going on walking in the evening can do quite a bit and so on. So I want parents to be mindful. It really starts sometimes at home. What we do at home goes a long way as the children gets older. Doc, thank you so very much for coming on. I know we had some technical difficulties, but I think the message that you sent out there was clear, and I hope that persons within our community take heed, especially our young people and our men in our community. We're hoping that they can take all what you have said into consideration. We're hoping that the wives can encourage their spouse to come into our wellness centers. Again, we have the men's health clinic at Soufriere Hospital every first and third Wednesday of every month. We quite seen our numbers are very low, and we're mostly seeing the older persons. So again, we're encouraging the younger persons, the younger men to come to our Soufriere Hospital on men's health clinic. It doesn't have to be when you're seeing signs and symptoms of a condition. It just could be just for a little checkup, and speak to the doctor, get accustomed to the system and so on, because there are so many services that are available at our wellness centers as well as Soufriere Hospital. And don't forget, the theme for this year is measure your blood pressure accurately, control it, and live longer. And that's what we want persons to do, to live longer and to ensure that they can control their blood pressure. Let me just say thank you to the staff at Soufriere FM, especially Erlan and Romanas, trying tirelessly to keep us keep the system up. So again, thank you so very much. Do have a wonderful day, everybody, as well as a safe week, and do take care. Doc, thank you and goodbye.
All right, thank you for having me. Have a good day.
All right.
Likewise, take
Bye.
care.
All right, bye.